My presentation is on non-Hodgkin's lymphoma prevention for ages 60 to 67. So before we go into prevention, it's important to know what it is, symptoms, and causes. So we're going to explore a little bit before we jump to prevention. So it's a cancer that is in the lymphatic system. This is a disease-fighting network. So this includes the spleen, the thymus, lymph nodes, lymph channels, tonsils, and adenoids. So our adenoids are up behind our nose, our tonsils are in the back of our throat, and then I'll show you the spleen and thymus on the next page. We're not going to go a ton into what these do because this is more anatomy compared to the prevention. So these tumors develop from the lymphocytes, and again the lymphocytes are the white blood cell and they're part of the immune system. So right here you can see the thymus, and then here's the spleen. So if you look at the green, this is where the lymphatic system is, so it goes down our legs and our arms and up into our face. So the symptoms can be a fever, night sweats, fatigue, swollen lymph nodes. So this can be in the neck, the groin, and the armpit. And if you're unfamiliar with the groin area, kind of think of the underwear line a little bit, kind of near the abdomen and the inner part of the thigh by the pubic bone. Chest pain can also be a factor, and weight loss. This needs to be like excessive weight loss, not just you threw up for a few days and a couple pounds. It needs to be continual and excessive. The causes, actually from research on the Mayo Clinic, the Cleveland Clinic, they're unknown. They think possibly a weakened immune system, too many lymphocytes, those are the white blood cells. But honestly, they're not 100% sure. They think it has to do quite a bit with B cells and T cells. So the B cells create antibodies to help fight off invaders, like foreign bodies that come into our body. And then T cells fight invaders directly. So these are very similar, but they kind of have a different mechanism of action on how they fight the invaders. So the risk factors include an organ transplant. So not necessarily the organ transplant, but it's the medication that suppresses the immune system, and in general any medication that suppresses the immune system can be a risk factor. Viruses and bacteria, so the human immunodeficiency virus, this is spread by contamination of blood. Epstein-Barr is a virus similar to mono, and then I apologize, I probably won't say this correctly, the Helicobacter pylori, this is from stomach ulcers. And then chemicals related to weed killer and pesticides. They're still doing research, but they believe that's a risk factor. And then actually older age increases our risk after age 60. So for prevention, where they're not sure the cause, there's no sure way to actually prevent it. These are ideas that they believe and have been working on researching. So one of them is avoiding radiation. However, you have to realize the risk versus the benefits. If you have a different cancer and radiation is the suggested treatment, that's most likely more to be a benefit than a risk, because it's such a small amount that you would develop the non-Hodgkin's lymphoma. And then living a healthy lifestyle, so diet and exercise, avoiding breast implants, the scar tissue, they believe is where it develops the non-Hodgkin's lymphoma. Avoid behaviors related to HIV. We talked about that in the previous slide. It's blood contaminated, so this could be intravenous drug use and unprotected sex. And then avoid behaviors related to hepatitis C. So this is a virus of the liver. So in addition to the hepatitis C, that's also through the blood contamination. So sometimes you can get it actually through a blood donor. Which, in addition, you got to look at the risk versus benefits on that. If you're needing a blood infusion, the chances are pretty low of getting hepatitis C from that. And then these are my references. Thanks.